Hey, are you a business owner, entrepreneur, or professional? If so, we want you to apply to be a featured guest on our show. My name is Adam Torres, and I host the Mission Matters series of podcasts. I've recorded over 3,000 episodes, and we are just getting started. How do you know if you'd be a good guest to be on the show? Well, only one way to find out, and that's to apply, but I'm going to let you in on a little secret. We want guests that have a story to tell, guests with a brand, a product, or a service that can benefit my audience of listeners. If this sounds like you, go to missionmatters.com and click on Be Our Guest to apply. I'd love to talk to you and get to know more about your story. Again, head on over to missionmatters.com and click on Be Our Guest to apply. All right, now let's get into the show. Hey, I'd like to welcome you to another episode of the Mission Matters Business Podcast, your source for all things business. My name is Adam Torres. You can follow me on Instagram at AskAdamTorres. Keep up with my book releases, book tour schedule, signings, all that other good stuff. Always love to connect with you there. And as always, if you'd like to apply to become a co-author of one of my upcoming books, just head on over to the website, missionmatters.com, and click on Become an Author to apply. All right, today I have Virna Little on the line, and she's co-founder and chief operating officer over at Concert Health. Virna, welcome to the show.
Hi, thank you so much. I'm glad to be a part of the show today.
All right, Virna, so I'm excited to get into today's topic. So we're going to talk about the role of primary care in providing mental health services. But before we do that, just to give a little bit of your background, tell us a little bit more about Concert Health, please.
So Concert Health is a behavioral health medical group that brings behavioral health services to primary care practices. Right now, we serve primary care providers in California, Arizona, New York, and Connecticut, and we'll soon be moving, hopefully, to South Carolina, New Mexico, and Florida in the next couple of months. So we're really excited to bring behavioral health services to primary care providers that wouldn't be able to offer behavioral health services to their patients.
So, Virna, I mean, the obvious question is, and I don't want to assume here, so why is it so important to engage primary care providers and to have them treat behavioral health conditions? Because I know anxiety, depression, I mean, these are all big topics. Like, why is that so important?
Well, I think it's important for a couple of reasons. First is that what we know is that most people go to their primary care provider first to talk about depression or anxiety, even if they don't identify as with depression and anxiety. So they might say, I'm having trouble sleeping, I feel very nervous. So they often go to their primary care provider to talk about some of those symptoms. The primary care provider is the one that they have the relationship with. And so oftentimes the primary care providers are the ones that identify people first with depression and anxiety. What a lot of people don't know also is that primary care providers actually write scripts for medications for depression and anxiety at a higher prevalence than specialty mental health providers. So that really tells us that people are going to and seeking treatment for depression and anxiety in their, with their primary care doctor. And when we think about now, particularly some of the mental health crisis that, the country is facing around COVID and social isolation, they're having telehealth visits and talking to their primary care doctors about some of those feelings and some of those experiences. And when we think about people in crisis, what we know is that many people who die by suicide saw their primary care provider in the month of death.
Oh, wow. That's pretty telling. And what it tells me though is that it seems like something can be done here, and that's what's very. I mean, I'm optimistic about it, and looking at what you're doing and how Concert Health is expanding. I mean, it's a big thing, especially right now. We're in the middle of, for context for everybody listening, we're recording this going into the holidays, so we're a couple of days away from Thanksgiving 2020. So middle of the pandemic still. LA just shut back down in terms of restaurants. I mean, there's a curfew, so depression and anxiety are definitely on the rise, to say the least. What are some of the best practices for primary care providers in identifying and treating behavioral health conditions?
So the first is to ask people about depression or anxiety. So there's a tool called the PHQ-9 or the Patient Health Questionnaire 9, and it asks people about some of the symptoms of depression. So for example, are you having difficulty sleeping? Are you eating too much or too little? Are you having difficulty concentrating? Are there times when you feel sad or hopeless? Are you having thoughts that you might be better off dead? And so those questions really help identify people who have depression. And one of the things that we know now is that primary care providers have a really good opportunity to ask people these questions when they come in for their primary care visits. And it's really helpful to identify people with depression. And the way that the PHQ-9 works, it actually helps the provider measure, like they would measure someone's temperature or their blood pressure or their sugar. They can actually use that tool to help measure their depression and talk to people about how things that they might be able to do to feel better and to reduce those scores. So those are conversations that are starting to happen in primary care practices around the country. So it's really important to both answer the questions if you're asked by your primary care doctor, and if you have a primary care practice and you're not asking, to start to look to do that in your practice.
Virna, what are some of the barriers to accessing behavioral health services, and how can these primary care providers really help fill these gaps?
So one of the things that we know is that there's a shortage of behavioral health providers, particularly in some of the rural areas. There are some counties that literally in the United States that literally don't have a psychiatric provider or may only have one psychiatric provider to cover the entire region. So
Wow.
There certainly is a shortage of behavioral health services. One of the things that has been really helpful in the past couple of years is that CMS passed codes to help primary care providers offer and be able to get reimbursed for providing behavioral health services in their practices. It's an evidence-based model to identify and treat depression and anxiety in primary care settings called collaborative care. And Concert Health helps primary care providers by partnering with them to bring collaborative care to their practices. And so we're really encouraged by how many primary care providers and organizations are beginning to adopt collaborative care, and that 18 states as of this month in November 2020 have adopted these codes onto their Medicaid fee schedules. So it looks much more promising in 2021.
So what are so final question, this is a two-part question, Virna. So, there's providers, this podcast goes out nationwide, so there's a lot of people listening to it. What are typically the types of providers that are primary care providers that are typically a good fit to work with Concert Health, number one, and number two, what's the best way for them to reach out and get more information?
So primary care providers who are working in community health settings are really great partners. We work with a lot of federally qualified health centers and community health centers. We work with a lot of OB/GYN providers because one of the things we know, the research is overwhelming in terms of the impact that depression has on pregnant moms and their babies, just in terms of health outcomes, well-being, the future and social adaptation for those children. I mean, the research is clearly there. So a lot of OB/GYN providers are reaching out to be able to implement programs to identify and treat depression or anxiety in their settings, and adopting collaborative care. So if people are interested, if there's primary care or specialty providers, women's health providers that are interested in information on collaborative care, or partnering with Concert Health, you can certainly go to our website, which is concerthealth.io, or you can Google behavioral health integration codes, and you will get those codes and information on collaborative care, or you can certainly Google collaborative care and primary care, and you'll get information as well.
Fantastic. Well, Virna, really appreciate you coming on the show today and sharing more about your background and what you're doing over at Concert Health, and really how you're out there helping primary care providers to help a lot of people out there that are experiencing behavioral health issues. So thank you for that. And to the audience, as always, well, thank you. And to the audience, as always, thank you for tuning in. Hope you got a lot of value out of this. If you did, don't forget, subscribe to the podcast, leave me a review on the Apple iTunes Store, and don't forget, share this with your friends. And otherwise, I'd love to have you be a return listener. And Virna, really, it's been a pleasure. Thanks again for coming on the show.
Thank you.